The Medicare annual election period runs from October 15th to December 7th of each year. It is also known as AEP or Fall Open Enrollment. It provides Medicare recipients an opportunity to evaluate their current coverage and make changes. Medicare is one of the most complicated types of insurance in existence. We know this because we live it. We talk to educated and highly intelligent people every day who have a hard time getting it right. It's easy to become trapped in the wrong plan or end up paying for medical care, prescription drug out-of-pocket costs that you don't anticipate while retired and on Medicare. Hi, I'm Rick Teska, CEO and licensed advisor of Strive Medicare. Whether you're new or already on Medicare, I encourage you to subscribe to our channel. Click the notification bell so you don't miss out on our upcoming videos. Today, I'm talking about the upcoming enrollment period Medicare has set up to start on October 15th. This time of year, we start to field a lot of calls from folks wondering what they should or even shouldn't be doing. Many people are overwhelmed and bombarded with all the ads on TV and paperwork in their mailbox promising you all these extra benefits when actually most are just bait and switch tactics. What should you pay attention to? What can you ignore? The first thing you want to keep an eye out for is the Annual Notice of Change letter. It is sometimes abbreviated as ANOC, and it is a notice that you receive from your Medicare Advantage or Part D plan. Depending on your insurance carrier, location, and how you choose to receive your plan documents, this letter will be delivered early to mid-part of September and could be mailed to your home or email address. The ANOC gives a summary of any changes in your plan's costs and coverage that will take effect on January 1st of the following year. If you do not receive an ANOC, you should contact your plan provider. I want to pause here and just really drive home that this letter is not something to ignore or overlook. Review this notice to see if your plan will continue to meet your healthcare needs in the following year. We help people every day over the phone, in the office, or through Zoom just to do that. And you can use the link in the description to schedule a free consultation to review your plan and answer any questions that you have with one of our licensed advisors. We work with all the major companies so you have access to what the changes on your plan will be for the next year. To help you prepare for this year's Medicare annual enrollment period, here's a quick rundown of what you can do during the Medicare annual enrollment period. You can change from Original Medicare, which is Parts A and B, to a Medicare Advantage plan, or also called Part C of Medicare. You can go from Original Medicare and a Medicare Supplement plan and a standalone drug plan and choose to replace those with a Medicare Advantage plan. You can also change from a Medicare Advantage plan and go back to Original Medicare Part A and Part B. However, Original Medicare only covers about 80% of your healthcare costs. If you choose this option, you'd also need to look at a Medicare Supplement or Medigap plan along with a standalone Part D or drug plan for your medications. You are allowed to change from one Medicare Advantage plan to another Medicare Advantage plan, regardless of whether the plan offers drug coverage. Enrolling in or out of, or even changing from one Part D prescription drug plan to another, if you carry standalone coverage, is something Medicare beneficiaries can do during this time as well. Making Medicare simple is what we do at Strive Medicare, and we understand that Part D shopping can be confusing and stressful. So we have a helpful tool to make comparing plans easier. Just go to our website, strivemedicare.com/drugs, where we'll offer a self-service option for you to compare and enroll in a prescription plan of your choice. You can also enter your prescription drugs and pharmacy information into our custom form. We will review and reach out to you with personalized prescription plan options. Whatever your situation, any changes you make or don't make during this enrollment period go into effect January 1st of the next year. If you choose not to address how your plan is changing and if it will meet your needs in the future, There are not a lot of options after the enrollment period, which again runs from October 15th to December 7th. So make sure you review your plan. Don't get stuck paying thousands of dollars by ignoring the opportunity to get your coverage right. This especially applies to those folks that are currently on a Medicare Advantage plan or Part D plan. I highly recommend that you review your plan during this annual election period so you're not caught with any surprises when the plan changes go into effect January 1st. Now, something I want to touch on, and I'm talking to those of you watching who are currently on Original Medicare and also Medicare Supplement or Medigap plan of some type. Your plans are not subject to this enrollment period. You are able to change your plan letter and carrier at any time throughout the year. Unlike when you first join these plans during your initial enrollment period or IEP, you will most likely have to answer health questions and go through underwriting process to change your plan. Well, folks, that wraps up my brief overview of what changes you can make during the upcoming annual enrollment period. Stay tuned. In the upcoming weeks, we will focus all of our content on this year's enrollment period. At Strive Medicare, we make Medicare simple every day. Our licensed team of Medicare advisors has been training and certifying on all things Medicare, getting ready for AEP, making sure we can help you. We work with over 20 companies in multiple states on Medicare Supplements, Medicare Advantage, and Part D plans. So as you get those annual notice of change packets, feel free to reach out to us for a free no-obligation consultation by scheduling an appointment on our calendar by clicking the link in the description before things start to fill up. Or call us at 608-784-8969. And as always, you can find us at strivemedicare.com. Thanks for watching.